Busunya me ma kwaba edeba tips and gist YouTube. Mechia mo nyina. Ena nwumre ede live yi impromptu. Esan se me de mo hye nyame bo a ochina. NVQ conversion anase NVQ discussion. Ena nyame bo ochina yebeye. NVQ National Vocational Qualification. UK certificate a omomko college e wa ha se koyo mo programs no eno na omoje. It is less than the degree obenya ewo university. Nanse uko NHS, the National Health Service, na okope ejuma ewo hɔ a, most of omo vacancies no, na omoji NVQ. Enti enkrofo bebre na astarte NVQ ni bi online. Ena Ghana for omo Ghana ne de bebre na din esan se pounds no. NVQ no obeye bi level 3 ni ade bi eji £600 ni ade. Menya nte yese bi mokra 1,500 pounds. I don't know how true it is. But oko onto the colleges na, omo websites na, it be charge £600, £500. Sika. Ebusia sika. Na eno ena the nurses and the midwives, and some of the health, can I say, even any nurses and midwives in Kwa, any Eurobia will be, you can convert your degree to get NVQ qualification or UK. Na for ebisa say we a nurse, we a midwife, and I say we a pharmacist, a pharmacy technician, we a radiology technician, we a nutritionist near the adena convert NVQ no, or certificate with degree and our diploma. The be NVQ na, ubetimi da be care job na, debi. O field na be convert no NVQ na ubenya no, be the NVQ in that field. Nyame bo na me cheche mu pa ye. Na ene de botaye nti amaba ne say, and most of you guys no modwen say NHS adwuma e wo ho nyina ema COS dabi. Enye NHS adwuma bia na ema COS. Se ukọ NHS for website a vacancies e wo ho no. Amo driver nyina wo ho, amo cleaner, porter, chef nyina betima kwa NHS akoye chef e wo ho. Na ono aduane ema omo patients no. Omo healthcare assistants, omo maternity support worker, healthcare support worker, omo nursing, omo midwifery, a doctor for vacancies nyina ewo. So NHS no is very broad. A lot of vacancies. Even the administrative work, this administrative admin support, administrative assistant, ni nyina ye vacancies are ewo NHS. Now the issue is say our certificate say obi kra committee or TikTok say or human resource management certificate be or convert here. Eno na maba say the issue ni nyina ne say o convert we na wonya NVQ now they can apply a juma na that admin support no will it qualify you for a COS. That radiology assistant no ebe qualify for a COS ana eno na ene ye wa ha say. So me do be call NHS website no so na share some of their vacancies. Na afa me wi me do akọ aban no website no so na ya hwe enwuma etimi qualify for a COS. Na chere say okọ NHS website ho a se wo hwe na wadwuma no it wouldn't qualify you for a COS a on ha wo ho kra enkoye conversion ene can say NVQ mpo na wo de akoye wo job application. Na chere say sa video we say na ebeboa because nyame bo ochina no me yes our video ni wi a wan hwe nkrofo ebekwa akọ convert o mo certificate ahopepere because obi epekwan atu a mo nyina be o madwen so mo de kọ NHS driver for be kọ cleaner for just obi ehu ne job role onya kọ NHS website no say ya advertise adwuma na o termine degree ana o convert nyame bo ochina ye beti ase ye pa conversion ni NVQ no but ene de enwuma ben na wo NHS a omoma ho COS se wo UK ha say na ebia wo de COS baaye NHS for ma wo COS a wo de be switch eno ne friend switch no wo be switch abeda NHS for de ne so se o Ghana na NHS for ema wo COS a wo de be apply the visa to the UK na ebusia before say ye be start no ma menkan omo ma ba say na o ma chiacha me no ma menkan bi nansen ya na menta enkan Sarah o say good evening na bra wodi na mitimi mo o say if I say tips you say just Joshua so say hi and Benjamin say my boss good evening menya your boss why Theophilus I say good work Benjamin say me ho te say me ho ye. And Sarah say I'm watching you from Jordan. And Michael Ato was say good evening. And Sweet Sandy was say good evening. Stella, I say I hope you. I don't really know the person watch. Kojo Jan, I say keep up. I say they keep the good works. All right, George, and so say good evening. And Mavis, and so Esha has say Irene, Ewa has say Frimpong Faustina, and so Ewa has say Salifu, and so Esha has say Obed, and so Sha Linda, Kwame Amo, and Jude. Oma me bubo mudi nyina ne nyina ye good evening. And how are you? And omo nyina e ka kire me. Ebusia fast forward mama yenye ne fast. Me de wo call the UK visa portal. Na yakọ hwehwɛ enwuma a qualify for visa. Se qualify for visa and woji hu COS meboa. Certificate of sponsorship a document binding you the employer and the government and to make you eligible for a visa. Want me apply a work visa without a COS. It is yekohu enwuma a qualify for a skilled worker visa. Any enwuma a qualify for the health and care worker visa. Na odie no yehunu wo field na wo no enye obi an peke job. It will field na wo no wo hwe na en qualify. That means you wouldn't get a COS for that job role. Nti yeko NHS wo na mo the advertisements na to ho na wabu anichi na watwam. Na yaye ne simple. Nti ne life na ye nche. Quickly, before say meko NHS for website e can say UK visa portal no. Shannon so say you will be a friend no the shortage occupation list. You can say be a shortage occupation e nyuma and a list there ya listing nyuma ni nyina. So shortage occupation list enyuma your shortage e wo UK ha say and no any friend shortage occupation list. Na sa list ni mu no sa enyuma no eno na ya na omoma ho sponsorship because shortage e wo ho a e na yekofa obi free Ghana and Africa eba UK shortage eni adwuma bi a kromafo na ebeye enya de omudi COS ebeto so si emfa nkofa obi mra. Na sa shortage occupation list no omasesa edin no aye no the immigration salary list. That is the current name 2024. Enti anytime be abekọ the visa portal abehu the immigration salary list no eno one na the shortage occupation list enkanetete na eda ho. Eti eho na ye bekọ akọhwe enwuma a ubetumi enya visa e de aba UK as COS eno na qualify for COS. Na ya yakọ NHS for enso de na ye de akototon. So my share my screen no na mo nhwe bi eno nti na maba YouTube mo pese mo share my computer no so. All right. Eti abusa hwa ase a was a skilled worker visa immigration salary list update no 10th July 2024 and the date 13th and 3 days ago ya and our update list no 3 days ago ya enti wo matete boga bi ekotutu mfuturo gu ani a mesi omonye research omonye research tete asem na ye ne yebema the current update because ye need research ho. It will share website na me wona gov.uk the home office I had to apply visa no gov.uk and I have to watch the skilled worker visa immigration salary list updated 10th July 2024 3 days ago and our yes update we say ebusia or say check which jobs are on the immigration salary list in each area of the UK on your job. Sorry, if your job is on the list, then the minimum salary is 80% of the route usual minimum rate. And Shahase, wa highlight bibi wa hase, was it to qualify for a skilled worker visa? Your minimum salary bia, it was at least sikano krano employer entry can also 80% of a buona we chato hono. Enti abine tabuo bia employers are omo ewo the immigration salary list and I said the shortage occupation list was this a wo ba UK aba be adwuma wo UK ase a e was a employer na etua wo ka sa sika no se employer na ntimi entua wo ka sa sika ne de a ene employer ne ni ho kwan se obegi COS amount e ho na nkomo ni nyina wo enti so ko ho cleaning e wo NHS website na cleaning na dwuma no salary a wo begi no what the quarter to the immigration salary list, or I can say threshold, no salary threshold, no, not entimi dra. That means employer no, or qua buying or money COS, no, their bro. Intending employer no, and COS and farm out. And yet, I can say requirement and our own meeting. asɛm ne tenten ne tietia nyinaa no. It was say the annual salary for these jobs are based on 37.5 hours per week. Into approximately 40 hours. So obey juma wa NHS and one year more 37.5 hours week biya. 40 hours and I say approximately 40 hours. And on a buy no and she say no. So we 40 hours no every na say a quine a bemusa week na ultimate about part time 20 hours and then your friend extra job and I say another employer obema part time job. Now the 20 hours be a day. Aka home. Na so 60 hours there ebusa usika no mu ayden ayedu but main COS no employer na ma wo kra no na nya 37.5 hours na ebusia was if you qualify for the standard rate so show rate na bibia qualify there then because you got your certificate of sponsorship after 4th April 2024, then you should look at the standard rate column. It is standard rate, no, because it's here. Moi, COS unya after 4th April. April ya 4th April. Se si no ubenya COS also ka ho entity. Obehwe ahase a column no na ewa hase no. Wa list adwuma bia any sika e was oba ebeje. Now on say wa trade the standard rate and wa trade the lower rate. Standard rate no asem na yeka. The standard rate no asem na yeka enye the lower rate. The standard rate. Now me pesa wo hwa ade ye wo a skilled worker visa or health and care worker visa shenenso. Skilled worker visa or health and care worker visa. Skilled worker visa no eye the tier 2. Eno na eye nnwuma bi e wo kroma sei bebre na. Ye wo other work visas to say the global talent, creative worker visa, graduate visa, any other thing na de ma watumi de adwuma wo kroma sei. Ba kese pa no na the skilled worker visa. Na skilled worker visa no owo enkorabata bi wo ho a was separate and also ka skilled worker visa no. Your friend no the skilled worker visa / health and care. Nti eno aye no mo twa de tintin tita nyina e friend no health and care worker visa. Some mienu we say na mpesa wo share so because NHS for nnwuma no bebre na hye health and care worker na say because e ho na kwaye hospital on say health and care. Etini nyina hye skilled worker visa na say but o ma separate ebi mo e do ma kwahye health and care. Accident o mo separate o mo ne say yesi san krofo ne de o ma dwuma no eso aban na near to the stand say o mo ntua health insurance e okrom ha say eye the immigration health surcharge. Into wa beji the health and care worker visa no a skilled worker visa there but untria health surcharge uni would dependent nyina eno nti na ye from the health and care for any the visa na kana health and care worker visa but obi a the health and care worker visa ba so what the COS ne ba you can say care job domiciliary na nyina obeji BRP no na attre skilled worker visa. It is telling you say it is part of the skilled worker visa but you didn't pay the immigration health surcharge. So you are classified as health and care worker visa. All right. Now, enyuma enka the health and care worker visa no so no. Wamo ena omo the actual skilled worker visa. This skilled worker visa. Eno na ban no actually wa ha say or say how do you qualify? Or say if you want to qualify, then you have to check the standard going rate. Na obesha ha say ya wa twa ebo bi ewo ho. Or say you must be paid at least 30, I can't say, sorry, at least 30,960 pounds per year if you are being sponsored for a job on the immigration salary list. And no, you're the lower and at 38,000 the highest. So, sir, energy. Enti wasi yentua wakakura no adwuma na oba beye wa no yentua wakakura no na enti wo hwa hase ya wa hase 38,000 wa hase wasi you might still be able to apply for a skilled worker visa if number 1 your job is eligible but your salary is less than the 38,000. Eti aban no emra no na 38,000 pounds 38,700 mo YouTube no you are all reading it 38,700. And no no obisa say enwuma ni bi wo ho a akatua ni ndru omo so betimi apply ana and o say ane enwuma ni bi STEM jobs to say science, technology, engineering, maths near what is that yeah fine that one you can qualify. It ebi wo ha was even you as low as 30,000 pounds 30,960 you can still apply for the a skilled worker visa. Ebusua, yemfa sa figures yi into yetrim, the £38,000 and the £30,000. Now fast forward, yensa enko yechi, na yensha ade wa say, yenko health and care worker visa. Health and care worker visa ne de ebusua, wentwa ebuo bia anto ho. Wentwa ebuo bia anto so. Esan say time a aban no increase the salary threshold no or exempted the health and care worker visa for no free so it no they are not going according to the £38,000 and £30,000 sa emra no they are not going according to that. It wa wadwuma mebodin mebebobo enwuma o mo health and care worker wa mebo wadwuma so no don't worry about the 30,000. Would you COS na employer and say obema 25,000 krana you can still apply for the visa. But wadwuma ni so na o salary no endru 30,000 and above. And yeah, the STEM I can say jobs no so the science, mathematics, engineering and eba fine. And no obete so about 30,000. Anya sa dia keneke 38,700 you have to meet. Into number one, it's either you are part of the health and care worker visa, I exempt from the threshold. And I say you meet these two 30,000 and the £38,000 threshold. Shannon so enyuma ben na award the health and care worker visa no. So health and care worker visa enyuma ben be qualify o. What say to qualify for health and care worker visa, number one, you must be a qualified doctor. Into your doctor na utimia, you qualify for health and care worker visa. And sa ejuma no ebi ewo NHS. And you don't even have to worry. COS to say bam. You have to a nurse. Oka nurse na midwives nyina nurses. So any type of nurse, midwife, mu nyina mo nurse. So a qualified doctor, a nurse, health professional. Your other health professionals are omo nyina ehihim to say pharmacy technician, pharmacist, radiology technician, nutritionist, any sa enuma ni nyina no. Ebusua omo nyina health professionals. Omo nyina ehye the health and care worker visa na say. And an adult social care professional and no any the care job. Not just almost penny for adult social like social right community. So they take care of the community people in the domiciliary and the care homes. So the adult social care professionals no the care job. So before you qualify for health and care worker visa, no, these are some of the jobs. The second eligibility was say work in an eligible health and social care job. Until we qualify, and what's the same money our boss no, you should be working in and some qualify. You have to work for a UK employer that has been approved by the Home Office. And there you are aware. Get a COS, so have a certificate of sponsorship, a COS, and you have to be paid a minimum salary. How it depends. It once a way say no, they didn't go by the £38,000, but also a minimum salary. Into minimum wage, say now calculate and na calculate. So currently the minimum wage is about £11.60 or so, right? It is employer and about 37 hours, 0.5 a week. Now I multiply by the year. Now what share no the Ketriana amount. Wama Ketriana by any chim. Abai ni 1 hour bia de also de ma and when him week bia hours also de ma it wo chichem na less than that £11.60 na o apply visa unya me kai last year May one lady care job ya on krasatam na de mo to ni bi okotobi but nipa no salary no treto so no se o calculate a na omo ye no full into hu the minimum hours no into omo ye say bia the whole year you betu aka bia £20,000. But me calculation no me calculate no hours no na employer no so obema no was it 48 hours a week. It me say 48 hours a week. Now you're 52 weeks there, then you have to multiply by 52 weeks and then you strike. And I'm striking here no na less than so time na minimum wage £10 50 pence or so. Name drew, and that is why I'm refusing a visa. And the Home Office catches on some another COS from the employer. And to wo by yes side jumana ya mouse US na feel when it share the minimum wage 1 hour be a say okay because it's the minimum salary more the yen trouble be amamo it share the minimum salary hours no na share week hours abe a week na multiply by the week ubenya 1 week usika na multiply by the number of weeks in a year na wahunu say antali the employer na edema wa that means say If it is less than the employer and it is greater than what the employer will pay you, they will refuse you the visa. For instance, why your calculation say they be 1 hour, over £11.60 week. Employer and so 50 hours and 40 hours. 1 multiplied by 40. Now what's multiplied by is it 52 weeks or 56 weeks in a year? I've really forgotten. Now I multiply by the number of weeks in a year. We remember when you're £25,000. Now employer and COS no what say Obama £22,000. That means say you be refuse visa no because the employer and the amount is not meeting the minimum salary. So momo the answer calculation no etie. But the health the skilled worker visa for any day you chabwa mo either the £38,000 or the £30,960 na ye chama woman. You get it? Where is very, very technical. It is on the gov.uk. You don't need to be a lawyer. It is there. The information is there for everybody. Please let us use our phones to do research. It is for our own good. Obu a visa oda sokora no onim ehom mra. Waje no aba kroma say kokoti e na aba kroma da be obeja me. Enso ne visa oda sokora onim ehom mra. So these are how can I say they calculate the salary threshold. All right. Now, meba bebobo ejuma no so oma let's see ejuma no ewa say. So if you go down there, where are the jobs? Where are the jobs? If I'm using my phone, yeah. So I say check if your job is eligible. So you have to click on this. If you click on this, jobs in our list yaba. So the first job, I say health services and public health managers. It managers our health services, they are all part of the health and care worker visa. It either say nipa no a care home manager and also any manager our health our providing health service, whether a nurse manager, care home manager, any manager be a director, into health managers and directors are omo ye adwuma or health service, omo nyina ehye visa na say healthcare practice managers and also omo sha residential domiciliary care managers, omo nyina ka ho, biochemist and biomedical scientist. Utie me now ye biochemist, biomedical scientist, mo nyina mo ye adwuma hospital. You are all part of the health and care worker visa. A wo ba kroma se ya onfa we can say untua health insurance. Wo yere no ma nyina obia entua health insurance. Bebre kra nim omo nim say nurse, midwife ne care. There be adwuma bebre wo. Physical scientist, omo nyina she health and care worker visa na say. Generalist medical practitioners, a doctor for nyina ehye ho, general doctors, specialist medical practitioners, a doctor for ma specialize, womo nyina eka ho. Physiotherapist nyina eka ho. Occupational therapist, speech and language therapist, therapist and cognitive behavioral therapist. Omo nyina eka ho. Clinical psychologist and all other psychologists. Omo nyina eka the health and care worker visa no eho because omo nso etumi koye adwuma e wo hospital. Etenyuma me bobo so nyina wunya bi eba UK a enya de obetua the health surcharge, the health insurance, you and your spouse, your children. Midwifery nurses, midwives no, midwifery nurses sana omo ka midwifery nurses, okay? Anti midwives, when you midwifery nurses are, let's just say midwives, because Chrome has most of the midwives, omo RN, adult nurses, no mako specialize, omako yo masters in a, and it's no bibisa so person obey masters or the degree make us dabi. I was obey adult nursing, Chrome has now we do our NHS kakran, and wako yo midwifery, and on a most of the universities wa has in san omoye we adult nurse. So the other time no bibisa so a diploma nurse or person obey 3-year degree, I'm can say dabi. Uwe 3-year degree no mpukura na in a midwifery na osaka koye masters eti beye 1-year top up in adult nursing na efa koye masters no na ebeye midwife nurse eti sa no mkan midwifery nurse. All right, registered community nurses are more Ghana. You are able to change more to a nurse associate and you'll be working, you are registered, you get registered with the UKNMC, you work in the community. So registered community nurses munyina, registered specialist nurses, registered nurse practitioners, registered mental health nurses, registered children nurses, and other registered nursing professionals. Other nurses are mambo mudin, mo nyinaa mo ka the health and care worker visas ɛho. Pharmacist mo nyinaa mo ka ho. Optometrist, dental practitioners, medical radiographers, mo amutwa X-ray, radiologist, and amuka radiographers. Mo nyinaa mo ka ho. Paramedics, eno na Ghana kan ambulance services no. So paramedics, the eba kruma say that visa, you're all part of the health and care worker visa. Podiatrists, all other healthcare professionals not elsewhere classified. Let's just say the new refi wa mumodi, but munyina mo healthcare professional, munyina mo ka ho. Now yembra social workers, kroma say amanfo bebre o masati ko sa program no is very very nice program. Social worker and also a health and care worker visa nibia. Laboratory technicians. Now me pesa mo shade bi nso. The word technician is different from assistant. Laboratory assistant enkona na laboratory technician. Technician na ankasa technician opemu no. And assistant there bia unqualified ba ukobwa. So if you go on the NHS website, now uko hu laboratory assistant enkasa tips ka say eka health and care worker visa ho etimenya COS. There be one assistant was a laboratory technician. TNE. Dispensing opticians, pharmaceutical technicians. There is a pharmacist technicians and I'm kind pharmaceutical technicians. Oko NHS almost side juma no wo and no ebema COS because I qualify for a visa. I a friend health and care worker visa. And I your pharmacist assistant. Oko boa pharmacy ni no. And no any heavy the assistantship no enka ho. So sa adwuma no I'll come there. If you wani now kwa NHS one kwa wrong application. Adwuma any ha the health and care no. Next as a wono ukwa apply sa adwuma na employer na also tua ka 38,000 pounds. And yes, I want to apply for a skilled worker because any health and care there. Next as I was skilled worker. Adwuma bi any hebia no I was skilled worker visa na se. E honso na yes 38,000 pounds. It is shining so. It took NHS a show salary no. Was na endu 38,000 pounds. Na enka list way ho forget it. Unya COS. Medical and dental technicians. Health associate professionals not elsewhere classified. Nursing auxiliaries and assistants. Nurse assistant for any nurse auxiliaries no. Omo nyina qualify. The ambulance staff, excluding the paramedics, because now we about paramedics in our hase. Apart from the paramedics, the ambulance staffs no munyina esa qualify. Dental nurses and so qualify. Care workers and home carers, munyina mo health and care worker visa no ase. And senior workers, senior care workers, senior carers, munyina mo the health and care worker visa ase. Or say, Obe qualifier, I was a winner Jumano. Number one, from the NHS. So you must have your job offer from either the NHS or an organization providing medical service to the NHS. And now say an organization providing adult social care. It either say ubenya offer from a care home. Sisi anso de lalai on beton amount 17,000 pounds. And a care home for the or modern the sa 3135 6135 any 6136 no omo na emfa dependent emma onfa ukunu na woyere emma ene wo ma onfa omo ma sa mienu na ma highlight no we na obetimi do dependent aba 6131 eno na wobenya no NHS enti ko NHS na atwe healthcare assistant a eno nie assistant no a healthcare assistant ba okobwa nurse for because NHS no enye care home hospitals it nurse for doctor for so you're going to assist them to okano nursing assistant and a nursing auxiliaries but obeko NHS for website no I know healthcare assistant ebi ha midwifery assistant ebi wa no atwere you can say yebeko you see so mono don't worry the moment you get a COS what the dependent beba because code albania a 6131 all right it was say main country say it's either you get the job offer from NHS or from a care home so an organization providing adult social care na minia say care home be na edebecho omo a omo betonto ama so maka so ba unya dwuma bi nye tie forget the last one ne consider the first one the NHS and therefore ye free has ya now if ye hunu enwuma a qualify for the health and care worker visa ehunu say omo no de won hia salary kese bia salary ni de hia ne say a bro the minimum wage in so. And I say it's up to the minimum wage. Ubenya who's US because it qualifies for a visa. So wajuma ewo NHS na any dem boy, for instance, cleaning. NHS or afọ say be electrician ma wo driver hook ni nyina ye hu wa ha sei na say nnwuma ni nyina skilled worker visa na say was skilled worker visa ne there na me ka kire say if the salary even cleaning crank the kind of say the skilled worker eligibility no ho enti nnwuma no even say pharmacy assistant, laboratory assistant, radiology assistant and the health and care worker. Health and care no technician for no any assistant for no. So no, you will be under the skilled worker visa. A honso na salary no 38,000 pounds. Now I am asking you, say, Minia, employer benefit you say no. Therefore, one who say it is not possible. And you make a simple analogy and I de aye. Adwuma ni health and care worker visa na say the enka minimum wage ebeji COS e de aba. Wasi eni ho a na say was skilled worker. Skilled worker so ye call ho emran say you have to be paid 38,000 pounds 700 38,700 pounds. And I say with the engineering, mathematics, STEM subjects no what is our qualification there then obeti so about 30,900 and 30,960 almost 31,000. Now me bisa say a pharmacy assistant ubenya say sika no employer be na ye willing. Employer NHS they don't pay higher sao enti ebeye din so be convince employer say oma sa you get it. Enti at this point let us go on the NHS website and look for some of their jobs and their opportunities. Now before they call NHS for websites Shannon so on the NHS website the National Health Service Ghana and Quebec has a Ghana Health Service GHS, right? It's a trust bebre hospitals bebre and omakom ho abom. Omo na do mu vacancy omo website. Me de omo link no ato video we asintu we a obetimi aboso na wakakwohwehwe enwuma ne bi. Those NHS for no omo requirement a omo je paye the NVQ. Nyame bo ochira ye bedi NVQ no ho nkomo. Ene de ma hyeda me pese hu enwuma no na obi a twere na dwuma eto ho. So oh okay we qualify we she healthcare assistant ase we ase obese physician assistant yes so physician assistant and she physician assistant eka ho eno no ewo ahase hwe eno no ewo ahase where is it all still bibi wa ahase or say other healthcare professionals not elsewhere classified so physician assistant any other healthcare professionals omo ka ho okay omo ka ho tisha so physician assistant eka ho other healthcare professionals not elsewhere classified. Now is a one body krana. Now a healthcare professional or all right. So you don't have to worry. And you might be to say, you kind of say, how do we call it? The assistantship yet to say care job. Almost a physician assistant, we a doctor, you get a license. But the other assistantship to say a radiology assistant, and on one here license so to say obia or assistant radiologist, you don't even need to go to school. Sir, what they call NHS for and you see their omoji GSC I can't say it is GCSU omo SHS certificate and open omoji. But physician assistant there a medical assistant a wako school one more profession and the assistant no was no emane confuse you ebi ameka radiology assistant na confuse you a radiology assistant NHS for the no obi abetimi akoye we dependent wa ha you just go and assist the radiologist you're not even going to operate the machine you are going to work at the radiology ward right a different from physician assistant is a profession you need a license to practice it is a nursing assistant say yes. Okay, you need a license. Eti mono mo ka ho. Omo here license to operate. Na omo ya assistant for no. Omo no na make say they are not part here. Cook, porter and sankrofo no. Omo mu ni has say, okay. All right. Now let us go on the NHS website and search for ourselves. If you come here, this is the UK NHS website where you can search for any job. Now, if you are searching for a job, Shannon so say enyuma omo use band e wa ha say okay. Now ye ka band a dibre in health no. And I say oba nursing kra na Ghana na yehu ne nursing. But in health no omo wo rank. Ti say Ghana kra say police kra or sergeant corporal ne sa nema no right. Sana UK NHS no so etie. Eti omo ye no band ti say rank. Eti ye care assistant now ye band 2. Unhu band 3 and NHS we you senior and that's why you higher than you. Band 4 you higher than you. So now you're nurse, registered nurse. Now you're band 5. Unhu band 6 we higher than you. Eti rank Ghana there. Nurses na you to say we nursing officer, senior nursing officer, senior staff nurse ni on say rank no. Nti ha no mo use the band. Now banda adwuma you can say COS edaso no back care side no every band 3 echo. Band 3 echo. Shannon so banda COS edaso omotama COS band 2 omema COS krana is one ebia hospitals be 1,000 na ba kope. Most of the NHS trust no band 3 care assistant for no moma ho COS. And the other unit there to say physician assistant ya mokaye nurses midwives in you know say your band is higher, so mo there you all qualify for a COS. Care for no na a free band 3 echo. Eti eya no ahye so enti wo search adwuma na search say a care job na opa search the band 3 healthcare assistant. All right, now o search ya the enti amumu bebre oh the enti amumu bebre mo search adwuma na you don't get more resource. And the keywords am we use to edit search adwuma. NHS trust me ka NHS trust a hospital fashion trim. NHS trust for no obia wo the way we qualify na adwuma. Eti obi wa ha instead so betre healthcare assistant no otimi tre maternity support worker na chese wo ye carer ukoye adwuma aboa maternity for no minim se wo tie de make na eti wo kona kwasachi healthcare assistant unya maternity support worker no resource bia emma eso na maternity support worker ehihye ho kwa ebi wan so otimi no healthcare support worker instead of healthcare assistant why in healthcare support worker. Eti wo list say open adwuma vacancy in healthcare assistant healthcare support worker for no you not see those NHS trust no anything na bebre no mo search adwuma na my limited. So keyword abet me use number 1 the band you need the band 3 never care pe. So type it band 3 care CARE band 3 care what baby what no type it fashion obi wa TikTok ordina so na etie wo wi akọ NHS website obekọ na ne refi de mekan ye ohunu omo ha se mehwe o wo wi a na wasaba wodi emu tips apply NHS ma memenye na wakọ na obi atena se na waye na waje £2,000 abranso a wankasa betimi de wo phone ene wo data akọ ya application o metie bi obetena TikTok sa data wodi tie no sa data na ewo YouTube but omba obetena TikTok wa na ohwem anim se yasem manim na ye ofede ya I don't know. But we are learning from the website. And the website, you know, a contain you can say hospitals, edin, or more address, any other idea. Mean to me from my TikTok, or me ban them account. And that is why I don't do these things on TikTok. You have to understand it. Say TikTok, oh your life, you stream me a email address, any a can say residential address of specific agencies near you. A personal information I would do to and go against TikTok policy. Etimeya life you say now, I will encourage you to join me on the YouTube. Now I share a yinibi na ka utrim. All right. Enti abusia me ba be bo ahye ha say. So me be type bantre care, right? Iti bantre care no e na ma type e de ahye no. Where which part of the UK e na wo ba. Inti ubetima anka ubetima abo Bristol, ubetima abo Manchester, ubetima abo London. But de biam catch you say, baby a ubesuma abrewa akoto bia ope. Umu no ho papa upe COS no. Enti wo no enya afi na obe select Bristol. Na chese adwuma ni nyina akoye Bristol adwuma nkwa da bi. Eti ho no jaho space no to. Na ebo search. Wo de ebo search ne so. Ubo search ne so a was it 15,759 jobs. And e bantre care. Enti ubon se ebia ni din Ebiane ni din. Ebiane ni din. Now we say bantre care of elderly stroke. Let's say stroke patients. A medical secretary bantre care for the elderly. We don't need this. Young form. We crown was a part-time. So it is not going to help you. Most of the part-time don't have a COS, a full-time and a war entity. Na so. Receptionist. Aha, ebinie. A receptionist. Bantre. Now, the question you ask yourself is a receptionist part of the health and care worker visa? No, but NHS for a be a receptionist ama wo. Enti obekono obema wo employ as a full time obema wo bibia akoye adwuma. But the thing is, visa ben abeka akwaje. The actual skilled worker and yet the health and care, because health and care receptionist and home. And the actual skilled worker so say salary was a wumiti 38,000 and that's 30,000. She salary almost some of the amount. And to qualify with there be. So you shouldn't apply for this job if you need a COS. But kroma about the dependent nebaye. Now when you juma, this is the right job for you. Difference no. So here visa, here COS, then this is a proper job for you to be a receptionist. Memensa insisu biem. Eno nti na medi kan de ukosua de me kire wade a mpese wote ase from the genesis. Anya sanka start wa hanka wonte hwe ase. Eno nti na ma kire visa ni mu. Say your visa ni mu mienu. Your skilled worker visa e wo ho. And your the health and care. You see health and care for ne de salary bia employer ne de be ma obi a. De hia ne say enye lower than the minimum wage a obi anim say £11.60. Enti momo de more than chain. Sa nyuma no na mebobo kire mu from nurse, midwife, doctor, pharmacist, hwan ni mebobo ye. Ena the skilled worker visa no, wo mo ne de yesi agi se wo be qualify a employer akro no, why willing so betua ka £38,000. 700 kra bi sa dan chain. £38,700. Anya sa na wadwuma no, STEM job ena wo de ba to say mathematics, engineering, any sa enuma ne dia, then obete so about 30,000. So employer bit ma consider about 30,000 then obefow. Now this is a receptionist job, band 3, NHS, band 3. Now oko click we so a obeka just so here NVQ. Obeko no watwere yenko hwe ayi requirements no. Ewa hempo. She ena watwere no training or vocational level 3 ena watwere no. The vocational NVQ, national vocational qualification level 3 and also ope. Eti wan hwe ya wobekwa ko click so say wo receptionist no was say hu NVQ no nti wadwen be ye wo say oh ene menya COS but owre fi say visa kora bekwa akogye no it's a skilled worker visa salary kora no dey ma no it will not meet. Eti wo ye dependent e wo krom ha say ya na wonya adwuma nya wo na wo say where a receptionist is something like a customer service. Eti wo ye obi a wako school edu akire, wo degree bi, wo diploma bi a in any field we ni kwasa wo ye care. In any field no wako convert it to NVQ. They hear us about demonstrate say uni medjuma no and that will be on your CV. Okay, because we wanka was say training of vocational level 3 or equivalent of experience in the relevant role. Inti adwuma be na akwakoye a reception. Enti ebi mo hospitality any other idea mo betim da kwaya sa reception no so wo convert kra na ebi kra na wo degree a wakonya band 4 and band 5 wa broso mpo na nka wo de akoye but the thing is wo Ghana wo ntumi nye bi ena wo UK na wo PCOS a wo ntumi nye bi omo PCOS ti say dependent for no omo na betim ayesa adwuma we because machire omo say it wouldn't qualify you for SCOS but betim qualify ama wakoshe NHS ediska. That is the difference. All right, yes anko yachi. Adwuma we say clinical health care support worker. Healthcare support worker. Ebianon we a care job but a part-time enti yemontungu. Okay. Podiatry assistant. One say ye call main you can say UK health and care you podiatrist. But we was a podiatry assistant. It you are going to assist the podiatry. Na yonkoshe qualification. No? If the qualification is not a licensed job, then you will not qualify. What's your qualification now? One, okay, we was a COS either. So that means that they know it qualify. So they will give you a COS. So what that program no now? So was it previous experience working as a podiatry? Okay, it will obema COS. In the end, the one actually was a certificate of sponsorship. Or see applications from job seekers who require current skilled worker sponsorship to work in the UK are welcome and will be considered alongside other applications. It was a OPE, COS, skilled worker visa sponsorship. You are welcome. Obey official, apply to them. Okay, apply to them. And I also obey DBS near that. And we Ghana a police report, right? Into podiatry assistant, COS edda. So make sure say no be share the other healthcare professionals not else can say elsewhere classified. But the problem no one you be drew to say cleaning for next and you be drew. Admin support bantre. Let us see. Admin support. Admin support because administrator nankasa kura enka the health and care worker visa no. So let us see. All right. So one list COS BR you see, your cost forms are one list COS BR that means any do bit me amount COS. But what's it NVQ no obedi level 2. We call the level 2 and level 3. It was it NVQ level 2. And I say obedi the QCF and most of you don't have, right? So any administrative can say be now Chrome has here. Here COS just go and convert to NVQ. Ebi kura no akonya level 3 higher than that. Never koye ne kwehye na sika wom. Right? Sika no ano hye. We also closing date 18th July ya and 13th. Aka 5 days normal close sa opportunity no. Maintenance assistant. Ebusuanti won say NHS for enwuma egu odoso. But ye de ni akoto ke. Nti ene ye rewrem. Some of them COS qualify for COS. E bin qualify. So ene ye suade pa. So maintenance assistant. Now the maintenance officer na kasa kura no, when you're part of the health and care, non-assistant. So you see, so me sure say enuma bebrina omo can the health and care no, omo assistant might qualify. So let's see, who podiatry assistant. Let's go and see our laboratory assistant near here. Support worker. So this support worker is a strictly care job, right? Who support worker a care job, care assistant. And I don't know NHS, I can say NVQ obeje or say level 3. NVQ level 3. And nyame boch na yebehwe. So and on there you have to be either a nurse, a midwife, and some way to me convert. And yes, you have to go and do the NVQ. You have to go and do the NVQ. Okay. So that is a support worker. It will hear job roles now. It will tell you what you're going to do. And most of the time, no, you are even going to work in a mental health team. So you're going to support the mental health ill patients. Okay. That is what you're going to do. All right. And to mention it, so if you qualify our Coventry. So the other time I think Enra, na me your life, me catch them say there's the NHS trust is different from the hospital. So we trust no, your friend at the Coventry and the Warwickshire Partnership Trust. So that is the name of the NHS trust. Coventry and Warwick. I don't know Warwick and so a Coventry side of they are. Coventry and Warwickshire NHS Partnership Trust. But Open Hospital Crodia, bra from Enra me chere mo say enti omo ni employer ni din. Okay, so where the employer no the same employer. The Coventry no omo ana FA. Ebi o ha na hospital no esesa. So na eno so wahye so. We administrative admin officer and where there say definitely it wouldn't qualify you because administrator was it directors and managers, no administrator. So it wouldn't qualify you. Yanko. Admin support. Admin support we know quite to say Canada for because administrative assistant jobs no. And why a human resource bisa you can convert it. But say my mention aketria mo de bema. If salary mo de bema no, enya it wouldn't qualify for a COS. Until we one trace COS bia one trace us be or but then no obeshe qualification or so obeji the NVQ, right? Level 2 way. Who the C QCF na any NVQ ni na I think said QCF no me refinity, but any hint here and what was it the NVQ or the QCF? It's either NVQ or the QCF. QCF need them refi the full name, but NVQ need a national vocational qualification. Tiana watching so into call now who NVQ no actually QCF is the same thing, okay? It's the same thing. I think say Edina no master son and Nancy and maybe I think maybe yeah, um receptionist supervisor, therapy assistant, support receptionist, uh medical secretary. You see, housekeeper, Bantere, senior housekeeper, Okoye Juma Birmingham. So we Birmingham Community Healthcare NHS. Omo ehon akwakoye Juma. Now you see, housekeeper is just like a cleaning job. So the question you ask yourself, many COS Swana, a housekeeper, we cross senior housekeeper. But you see, Oko for you not see any COS because you know, say it is strictly skilled worker visa, not health and care because cleaning and count. And oh no, I just say we how we dependent. And I'll be to me then. Akwakoye. Enti eno say na wahye ne so. Okay. Now, maternity support worker band 3. We a care job. You're going to support the maternity. Okay, a care job. Into location or say antenatal clinic. And I will be called. Now look at something. Um, you see NVQ or say NVQ level 3. NVQ level 3 and our budget. NVQ level 3. Desirable NVQ level 3 and our budget. Now, my person shade. Oh, yes. She experience no, I see experience in maternity care, a care certificate, and able into where we are midwife or midwifery certificate in a bro sokra. A bro sokra. So all you have to do is to convert, okay? Is to convert to the NVQ and you are good to go. All right. Um Audit officer. You see, so the NHS they need a lot of staffs, not only the care for and the make keka will be a juma and until na more care assistant answer medic care no pay, right? Said a bay a best search around it. Community maternity support, I think say yakoshe back bibisa. Maternity for no the no super healthcare assistant bantare. Healthcare assistant bantare. All right. When so Birmingham, I think say Birmingham, right? I'm sure NHS Trust grow. Birmingham and Solihull Mental Health NHS Foundation Trust. I'm sure company grow. Ebi wahana trust nonko company nonko. Okay, we know one as I employer no. It's the same thing. It's the same can I say? One as I employer. So yeah, if you have any questions about the job, it is very easy. You can contact this person. NHS for one thing, no. Most of the bantere able are on first US, no, on trace US. Able on trace US. But once I care, now I qualify for a visa. I wouldn't say care qualify for a visa. Now you bantere no. And I be bro on my US, but ebi wɔ hɔ ɔbɛka kyerɛ sɛ ne mɛyɛ adwuma for 6 months na waswitch or the COS number ɛno nti na wohu sɛ waleste ɛwɔ hɔ no so wobɛtumi afrɛ nipa korɔ no the ward manager right ɔmo ana de ato hɔ so nipa ne din nie ne telephone number nie ne email address so all the NHS trusts a mɛkɔ hɔ biara no ɛyɛ a mohwɛ me mo right hand side you see nipa wɔ sɛ mo contact no so you can just send the person an email and ask say I saw your job as a cancer Bantere healthcare assistant, but I didn't see a COS. I need a COS. Are you guys able? Okay, into we see we are not able to support application from job seekers who require visa sponsorship into we also want farmer more. So only they were listed at all. So you don't have to call. All right. But if you don't have a way dependent, I can just go there. Okay, you can go there. Um Pharmacy assistant, band 3. Now, pharmacy assistant, let's see if they're going to give a COS. They didn't list any COS. So this will be very, very difficult because pharmacy assistant, I don't really know if it is part of the other healthcare workers, not elsewhere classified, and as a strictly skilled worker visa. So if you are not able to determine, now on trace COS, you can contact them and ask them, we working part-time, forget about it. Unya part-time and shampoo. You share full-time for no. Hematology, okay. Healthcare assistant, full-time, full-time, part-time, okay, what 3. Yanko form. All right. So I think say now we are able to understand if we want more of the care job, let us add assistant to it. Then another day, who say now we are moving to the carer into a bay years and microphone in every war. Hey, still not it at the Omasaba. Care assistant band 3. Mammy and care assistant band 3. Healthcare assistant, mammy and a healthcare assistant. There's some maintenance for any for now focus on care for no. Because care for 8 pa. Ha. All right. It's about healthcare assistant band 3. You get a lot. Band 3 senior healthcare assistant. We Lincolnshire Partnership NHS Trust. Full time. Okay, let's see something. Are they the same employer or different? Okay, they are the same employer. But mon shade address no on the hospital need Francis Willis Unit, Lincoln County Hospital. That is the hospital. And NHS Trust, and I the Lincolnshire NHS Trust. So this is the hospital you're going to work, right? The Lincoln County Hospital. And the obu ha obey application, or your application we are. No, as a committee, this same NHS Trust, or committee, or say, my application, mom, there be able one trust, one trust, but different hospitals. And the air bra from one ebeshe, air de be a bra from the hospital, no. Okay. Yenshe a year oji. NVQ level 2 in care or equivalent and NVQ level 3 in promoting independence, working towards achievement. What is that? Qualification no. But we were interested, they don't give COS. On tray say COS that and on trend so say they will not give. So you can contact them. But the on man on the better go say they will not give it. But we were interested. Okay, so they might give you because it's a band 3. So just contact them. Ward manager nini, the telephone number nini BBA, okay. Just contact them. That's a way I show Birmingham for the share and a different trust. So they will say, I am mum focus we know because we're the confused. So it can be the same trust, but different hospitals. And I'm a catch them on into case area no yeah. And the because I share senior nursing assistant. Okay. Let me see. So NVQ level 3 and obege. Okay, NVQ level 3. So maybe Obeka healthcare assistant, Obeka nursing assistant, then you NHS. Okay, so this is a band 3. So oh your nurse, oh your midwife, I can just convert and go and do that. Okay. Oh crabina band 3, band 4, band 5, band 6 crab, right? Depending on where you know. So they give a COS certificate of sponsorship and what you know, so COS so. Okay, so hospital no yeah. I can't say hospital no I see. Royal Free Hospital and our trust near the Royal Free London NHS Trust. So that is it. Okay, so the trust is this, and the hospital, particular hospital, or my address in here Into Obenya, you can just enter their postcode and see where the building is. Okay, so the address is there, the hospital is there, and the NHS trust is there. Okay. Yes, answer check back on county for life in the So healthcare support worker band 3. Is it a full time? Avon for na Emma. Avon. Okay. A system July this are. So they're also giving a COS. COS EDA, so certificate of sponsorship. The I think it's a Juniper Ward, Avon and can say Racial Mental Health Partnership Trust. Avon for the Omagidino. Me was underline na yeah, some na man for apply call. All right, so this is who to contact. Laura, ward manager. Okay. So ebusia ye kase ye sechi a ye be sechi a ye nwie. Okay, ye be sechi a ye nwie. Now before I end this, Shannon so and the job application. I just wanted you to see some of the vacancies and they qualify for a COS. Some of the vacancies, some of the job roles, they are not part of the health and care worker visa. So salary, ebe real. And humanity they are under the health and care worker visa. One thing about health and care worker visa is baby one all other healthcare professionals not elsewhere classified. Sa or my young classify woman is a bit confusing. And you have to contact the employer and ask. But remember what is admin assistant and your health worker. You are going to work in a hospital, but administrative work and yet health forget it. Okay. But a a confusing yet is a pharmacy assistant, radiology assistant, and yambo omudino. Okay, omono now you have to contact and ask if you'll be eligible for a COS. But receptionist, cook, cleaner, driver, electrician, plumber, name a year NHS or no. You have to make sure your salary is meeting the skilled worker. That is the £38,000 threshold. Okay. Now, if you get a Juma COS, that's to say we say Western Supermare, Eben Bristol, Western Supermare is about 30 minutes I can say drive. Okay. So when you a Juma BCA, now we application now. I have taught job application, how to apply for a UK NHS and go and watch that video. You have to contact into once you actually apply for this job. You just click on it. Edobeko track website. Now why you CV supporting documents. How to prepare the CV, how to prepare your supporting documents. Now the application. I've taught you already. What you need is the requirement, the NVQ. Into I say or COS no. And to assist CEO sponsorship. If you are a candidate wishing to apply and you require a skilled worker sponsorship, you can determine the likelihood of obtaining a COS for the role by assessing your circumstances against the criteria on the government website. Into ono kwa cultural, and uti na midi kind of call government in the website ono. Into what is a open COS there, then call government website ho, and no the amano gov.uk, ne health and care worker visa and assess so o qualifier. Ba medical de mako hodada. Into one say manya wabro. Employer no kra show. And so beka tips. And I didn't want na ade kon wan employer no na aka kire no. O se ko na ko kenkan. Ansa kra na waba be application. You see, nti mo say the edi kan ye no eboaye. So we don't even have to go under the gov.uk career health and care no. We know already. Okay. Yen qualifications no the obeje e wan himpo. Yeah. Into qualifications no na watre no obeje level 3. Or say level 3 diploma in mental health or health and social care. So health and social care no into o convert NVQ na ebema the health and social care, okay. NVQ in health and social care. And I say oh mental health or mental health nessa is very, very important. You can just apply to them. They take care of for the mental ill patients. Okay. Almost so SAS US Diana Air Fast they'll give it to you. they'll give it to you. Or more over 5,000 dedicated staff for Muno Juma. Okay, and they are in Bristol, North Somerset, any they make a catch say back when in Bristol. Okay, so they are around everywhere. Avon, yeah, they are around a lot of places. So that is that for today. No BBS say IELTS. IELTS is not a requirement for job application. The IELTS is a requirement for a visa application. Today we are doing job application, how to search for the jobs, get the offer letter, get the COS, and after that you go and face the visa application. So you call health and care worker visa, no? Where is it? You call it health and care worker visa, and sa visa na obekwa kwaje no. Say juma na obenya no say care job a visa we na ba beji nti ha na beba abe application. And if you come in to apply a whole no beka chiro into also overview. Now you click on the overview. Knowledge in English. Into a no beka chiro say you need to prove English. So either obe prove we nyina, right? And your countries be hard, they don't prove the English. Into a na obe huno. Or say, if you are a doctor, a dentist, a nurse, or a midwife, you don't need to prove English if you have already passed the exams, the language by your regulated body. Into your nurse, now what your IOT the ama NMC for also by applier, you don't have to prove English because they know. Okay. And more degree, you can convert to actors and then you can narrate, okay. Formerly UK NARIC. Inti eno no eba during the visa application. Eno nti na the main kan no, okay. So nyame bo china actors for no omo na ede ombe convert akọ NVQ. Nyame bo china. Ye wie a monsaka adwuma na wie. Moanya COS no. Na untre IELTS na wo degree a na sa the side degree no a convert to you can say to prove your English. Eti ye call actors for website obebisa o. Say there na opese wo yema o. Nyame bo china unconverted to NVQ mawa and as unconverted improve the English language and farmer. So almost services no a dozen actors for services no a dozen. So please don't confuse yourself with NVQ and IELTS. Obu ha unyaka NVQ now was me convert to mean IELTS. You still need to prove English. NVQ nature say qualify for care job no. IELTS nature say what brofo. That is the difference. Enti adwuma ne de wonim ye ane wa convert ye hunu se wonim ye na kasa be na ne broni be kasa French na wo kan na abrofo wote brofo de abe prove kire ye document be na de be prove o se kotre IELTS anase wo degree wakobo degree dia ene farmer ethics for na o confirm say ampa wo degree na o share so no watwa wote brofo, right? Enti that is the concept. So this NVQ is just to show that you qualify for the job. It doesn't prove say wote brofo. So that one is to the employer. Na unya offer letter na kwa your visa na eho ena IELTS anase actis no enso esa ebebem. Okay. Ebebem see mo amobisa no mon share so. Nyame bo ochina is this the same time I'll go to work, I'll close at 9, I'll get home eat. So by 10 na ye da so 10 p.m. So time na about 9 ewo Ghana na mon share so. And before I end this live, those contacting me, email, you have to give me some time. I'll respond to you. And those chatting me on WhatsApp, the messages are a lot. The messages are me call graduation by over 500 messages. I couldn't respond even up to 100 because the next day I had to go to work. My baby answer my bread. And one more me respond kakra no. One more class as a chatty be a gum. And one more me respond one more. One more so sa chatty be gum. Nti obu a waje me number Canada ke yi bae omu nyina chate saa. So ama obu okra na ebi kra wa base ope resume. Me hu bebe wa yina kwhye. So matwetwe mumudin wa ha say maka chem say Monday I will do it for you. Right? Matwetwe mumudin wa ha say. So please relax. Watch chat me na unya reply ya. Se maji details nkwa de a udin wa ha because message ni me reply. Me reply. Obu a obenya ne reply be 2 weeks time. Edoso. Hey, WhatsApp message baby sa day. So mo matwetwe mudin wa ha say no. Maji mu details say me ya ma no. What I'll do is menya ball number na or chat in the then I start working for you. Okay. So you don't have to worry. Even if I don't chat you, Monday I am home the whole day and I work for you guys. Okay. So I am on channel. So medamu nyina masi. Nyame nhira mu nyina. Bye bye.